Hi, I'm Dr. Lisa Conlon and welcome to the webinar for this afternoon. We're going to speak about the Master of Nursing Graduate Entry Program that the Sydney Nursing School run. Before we get started, I thought I'd just tell you a little bit about myself. I'm a registered nurse, having done my initial registration training program as an old-fashioned registered nurse in a hospital. I then became a perioperative nurse, so I was a nurse who worked in operating theatres doing pre-op and perioperative and post-operative nursing. I then joined the Australian Defence Force as a Royal Australian Navy nursing officer. My background is in emergency and disaster education. I've run emergency and disaster courses in China, Papua New Guinea and Samoa. And I do lots of management work, in particular lots of management work here at Sydney Nursing School. My qualifications are I have a Bachelor of Science in Nursing, I'm a Master of Clinical Nursing, and I'm a Doctor of Nursing, and my research is in military trauma. So enough about me, now on to the information that you really want, which is the information about our program. So my first question to you is, why a career in health? The reason that most of us join health and become registered nurses is that we want to care for people and we want to make a difference. As a registered nurse, we get to solve lots of problems and we also get to work in a multidisciplinary team. So this is one of the great advantages of being a registered nurse. We're part of the largest and fastest growing employment sector, with nurses being the largest members of the healthcare profession. We have a variety and we're able to become lifelong learners. Although I have 3 degrees, always looking for more things to actually do, and this is one of the great advantages of being a registered nurse, is that there's always more that we can learn. One of the questions we ask is, do you want to be part of the global health community and have the ability to work internationally? I've been very, very lucky. I've worked internationally extensively. I've just returned after living in Sweden and Denmark for 7 years, so I've had great opportunities of working internationally. We're a well-paid profession and we're deemed the most trusted and valued profession, and we have been for the last about 17 years. So we're well respected, we're very well trusted. We are with our patients at their most vulnerable, so we need to be trusted and valued. So why become a registered nurse? Again, we're very highly valued and trusted. We're with our patients 24 hours a day. So we're the people who have the ability to care for our patients enormously all the time. An enormous range of specialties, as I mentioned to you at the beginning. I am a perioperative nurse originally, but then I became a trauma and emergency disaster nurse. So the number of different specialties that we have access to specialise in is enormous. We actually make a difference. We are, as I said, we are patient with patients who are at their most vulnerable, patients and their families and friends. The ability to work internationally. So many registered nurses work internationally and make a difference globally. It's a very rewarding profession and career, and we're highly in demand. One of the statistics that we have from Sydney Nursing School that we're very proud of is that our Master of Nursing pre-registration students and graduates are highly saleable in the workforce. And in fact, last year we had 98% of our graduates get jobs straight away. Okay, the ability for us to progress in our career is enormous. So a little bit about our students. We're a relatively small school of nursing. We have approximately 1,600 students. We have small cohorts in our groups, which means that our students are very closely They work closely together. They work closely with the academic and professional staff, of which I have to apologise because I didn't actually introduce my colleagues at the beginning of this presentation. I'm not sitting in this room by myself. Thankfully, I have two wonderful colleagues here with me who are helping with this afternoon's webinar, Grace and Sally, who I wouldn't be able to do this without. So our students are, we like to brag and say that they're the best and the brightest. We have, we're very selective in who we admit to our programs, and there's a good reason why we are. We have high employment rates. Our students are very well respected in our clinical placements. We have approximately 30% of our student cohort are international students, which is an amazing thing to have. We have students from over 35 countries who are part of our cohort. It increases the richness of our student cohort, which also makes us a very diverse community. We have lots of our students who are also from our regional areas, our rural areas, interstate, and our Indigenous student population is so important to us. So who are you going to learn from? Well, we have quite a variety of people that you will learn from. You have academic staff like myself and clinical experts. We have nursing leaders. The education that you'll get are from highly skilled and highly educated individuals. All of your academic staff and your clinical, all of your academic staff at least, are active researchers. We're trying to make nursing a better environment. We're all published authors, so we're constantly being published so that the work that we do is being seen by people within Australia and internationally. In our clinical environment, we have cutting-edge clinicians. We have people who are in the top of their field clinically. And we have health reformers. We have those people who are making a difference in our profession. And these are people that you will be learning from. So a little bit about our program. Our program is a Master of Nursing pre-registration. It's a 2-year full-time or 4-year part-time program. It's taught at the master's level, so we actually teach to a higher level. We attract students from all academic and professional backgrounds, and this again adds to the richness of our student cohorts. We have, for our clinical placements, and in particular, one of the last clinical placements that you will do, we have some clinical specialties that you can apply to do your clinical placements in. Those are mental health, the high acuity areas, so perioperative nursing, intensive care emergency departments, high dependency departments, clinical departments, and paediatric options. So these are great clinical placements that you will be undertaking. Our clinical placements, and this is a requirement of our registration board, is that we require you to do 860 clinical hours over the 2 years. And there are some international opportunities that you can apply for in your final year. The clinical hours I'll talk a little bit about later on. We are very highly regarded and respected by our clinical partners. We work very closely with our clinical partners to make sure that our students get the most appropriate and best clinical placements to achieve their clinical goals. We also have clinical Commonwealth supported places available for some of our students. So what will you study? It is a very intensive program. It is, as I mentioned, a master's level. You'll be doing 4 subjects each semester if you're a full-time student. And in your first semester, you'll be doing 160 hours of clinical placement, and this will take place in either during the semester time or during semester breaks. And that's one of the things that we are very honest with our potential students, is that it is a very heavy workload, but it's worth it. You get a Masters of Nursing pre-registration, and you do this in 2 years. So in the second semester, you'll be doing 280 hours of clinical placement on top of your theoretical component of your degree. So in your second year of your program, this is for those students doing it full time, there is 180 hours of clinical placement. Things that you will be doing and learning about is caring for Indigenous populations, caring chronic conditions. We spend a lot of time regarding leadership and preparing you to become leaders in our field. In your final semester, there are 240 hours of clinical placement. This is 80 hours in the community setting. You'll be doing research and evidence. So we want to make you, well, we don't want to make you, but we want to encourage you to become lifelong learners and to research and use evidence-based practice so that the work that you do and the care that you give your patients is appropriate care. So now a little bit about our clinical practice. As I mentioned to you previously, your clinical placements will be in well-respected clinical facilities. You will have a clinical facilitator who will be there to be a conduit between you and your clinical placement. So they are employed the majority of the time by our school, and they are there to assist you with your clinical placement. We also have clinical simulation laboratories in our school. This is where we teach you clinical skills and prepare you to go into clinical. I've mentioned that there are 860 clinical hours that you will be doing. This is a requirement of our registration board, so that when you complete your studies with Sydney Nursing School and graduate from the University of Sydney, you are able to apply for registration to work within the health system as a registered nurse. So our clinical placements are in major teaching hospitals in New South Wales, in private and community health settings, in our regional and rural areas. We have clinical placements in emergency departments, in intensive care units, paediatric units, mental health facilities, oncology departments, aged care facilities, and community health centres. So it's a well-grounded, diverse set of clinical placements that you will be able to do your clinical placements in. There's also the opportunity to apply for overseas clinical placements. These placements are attached to your unit of study and will be appropriate to that. One of the things that we like to do is we like to share some information about some of our students that have already done their degrees with us. One of the students, you'll see on the screen some information that this student has said about the program that they undertook. They said that it challenged them, and it is very challenging, but you are getting a Masters of Nursing pre-registration, so you want it to be challenging. It encouraged this student to aim high, both academically, theoretically, and clinically. It was very demanding, but things worthwhile are demanding, and this student was able to gain a great deal of confidence, not only in the knowledge that she had gained, but in her clinical skills. This degree has made her feel excited about becoming a registered nurse, and that's what we want you to be. We want you to be excited about your future career as a registered nurse. One of the very exciting things that we have here at Sydney Nursing School is that we have a new health precinct. We're very honoured to have received a very, very generous grant from one of our benefactors, Susan and Isaac Wakel. And with that very kind donation, we're actually having a new health precinct built for us. The next picture, the picture that's on the screen at the moment, is some diagrams and pictures about our new Susan Wakel Health Building. This is for the Faculty of Medicine and Health, and will be hopefully moving into this while you are here doing your degree with us. We also have two campuses. We have the Mallet Street campus, which is where close by where this new building is being built. We also have the Westmead precinct, which will be opening in between about 2020, 2021. And some of our Masters of Nursing pre-registration students will be placed out here. They will do all of their, well, most of their education out there and most of their clinical placements. This new precinct out at Westmead is part of the Westmead Hospital. It is an enormous precinct. It is a very exciting precinct, but so is the precinct here in the main campus as well. So you can see on level 5 and 6, the University of Sydney will have their offices. So how do you apply to gain a place on the program? There's an online site that you can submit your application to. We ask you to nominate a preference either at Sydney Nursing School, Mallet Street, which is in the middle of Sydney, or at Westmead, which is about a 20-kilometre drive from here. Once you've done your online application, you will be asked to, or you'll be invited to undertake a numeracy and literacy test. And if you're successful and you pass the numeracy and literacy test, we invite you to come in for an interview. If you're outside of the Sydney area, we do these interviews via Skype. So regardless of where you are, we get to talk to you. So some information about the key intake dates for 2020. We have 4 rounds. The first round closes on this Friday, on the 24th of May. The numeracy and literacy test from round 1 will take place on the 11th of June, and then the group interviews will take place in July. We then will do first round offers on between the 15th and 19th of July. And you can see on this slide just the key dates that we will be looking at for the rounds. Scholarships, we have a couple of scholarships available for domestic students. Susan Wakehill scholarships for regional and rural Australia students, and scholarships for Greater Sydney area. There are also a couple of other scholarships available, the John and Diana Hutchison Merit Prize for Nursing, and the Hockmai Overseas Exchange scholarships. Information about the scholarships can be found on the website available at the bottom of this slide. That's it for me for the actual formal presentation component of this afternoon. We're just going to open up and see if there are any questions anyone would like to ask. We've received a couple of questions that I will attempt to answer for you. The first one is from Eliza. Eliza's written that she is interested in the Master of Nursing Graduate Entry Program and would like to know if once completed this Master's, will I be a registered nurse or is additional study required? What the university does, it offers the theoretical and clinical requirements for you to gain your Master of Nursing pre-registration degree. You then need to apply to APRA, which is the Australian Professional Registration Board, to apply to become a registered nurse. Once you have your degree, we will assist you in applying for your registration. The other question that Eliza has is there an option to do study exchange through this Masters? No, there isn't. This is a very, very tightly controlled program. Our program is accredited by the Nursing and Midwifery Board, so there is no study exchange programs. That said, there is the availability of you to undertake some of your clinical placements or one of your clinical placements and apply for that through through the program. The final question that Eliza asks is, what hospitals are nursing students offered placements in? And is there a selection process for this? One of the things that we have is that we go into competition for all of our clinical placement, and it's through a system called Concur. It's a New South Wales Department of Health program and system. So we actually bid for placements for our clinical placements. Our clinical placements are attached to our units of study, so they're the appropriate clinical placement for that unit of study. The clinical placements can be anywhere within the Sydney area, so our clinical placements can take up to 2 hours. Sydney is a very big place, so students may have to travel up to 2 hours to get to clinical placements. We also bid for rural and remote placements, which are outside of the Sydney metropolitan area. We have clinical placements at Justice Health that students apply for, overseas clinical placements that students apply for, and the air ambulance, we put out expressions of interest for students who are interested in doing clinical placements, a little bit different from just a general or from a major hospital. So Eliza, hopefully I've answered your question. Now I also have some questions from Timothy. Timothy's, I believe, going to finish your bachelor's degree at the end of this semester. Congratulations. But you won't be given your testament for your graduation ceremony until maybe December. This is not an issue for us. Please go ahead and still apply. We were able to see your transcript and how you've done, but please go ahead and apply. So you can apply for first round in the first round applications. Your next question, Timothy, is about the difference between Mallet Street and Westmead. Mallet Street is very close to the main campus of Sydney University in the middle of Sydney. Westmead, as I mentioned before, is about 20 kilometres from the main campus. The difference is that we have a small cohort at Westmead, and we only have about 36 students in that cohort. Exactly the same education, exactly the same clinical placement opportunities, but these are in the Westmead precinct. I'm reading as I speak to you. Advantages, there are very few disadvantages to either campus. Both campuses have the same support for students. The library facilities are the same. Lecturing is, if it's conducted at Mallet Street, will be streamed to Westmead, so our students get the same advantages from both campuses. Your third question, Timothy, is about how competitive the process is. This program is extremely competitive, as you would hope it would be. We only have a certain number of places available, so those students that meet the requirements will be offered places first up. So my advice is get in and get your place early. Your final question, Timothy, is about what makes this a master's degree. Students in this degree will be working at a master's level, so we will expect our students to write at a master's level. We will expect our students to be able to do research at a master's level, which we will teach you. The program is a very intense program, so it will be run very quickly, and that's one of the differences. You will learn to become a registered nurse the same way that our Bachelor of Nursing students learn to become registered nurses. You will just do it a little bit more quickly. Hopefully, Timothy, I've answered your questions. Now I'm just going to answer a question from Jimmy. What are the on-site and practical study hours during the course? The course is very intensive, so you will be undertaking a lot of face-to-face teaching in the program. It says you come from an arts background. It's a very, very different program from arts. You will be here, you'll be attending lectures, you'll be attending tutorials, and you'll be attending your clinical simulation labs. The lectures on the whole are not compulsory because we record all of the lectures, but we strongly encourage students to come and attend the lectures so that if you have any questions, you can actually ask us straight away. The tutorials and the lab sessions are compulsory, and we're very strict on that because this is a requirement for us saying to the registration board that you have met these requirements. I'd also just generally love to hear about the experience of both the degree and the job on the ground. I might ask you, Annie, who this question is from, if you could just send another message and just explain exactly what you would like. I'm very happy to give you information if you just ask your question again, please. And the last question I have here is from Claudia, who's from Brazil. I'd like to know the steps for foreign students to apply and if there are any funding programs. There are no funding funding for international students. The same process is for domestic students, so you'll be invited to undertake a numeracy and literacy test, which you do online. And if you're successful with those, we will then invite you to be interviewed. And you will be interviewed by either myself or another couple of our colleagues, and we will sit and we'll do a one-on-one Skype interview. For domestic students, you will come into Mallet Street if you're in the Sydney area, and we'll do group interviews with you.
A few more questions.
A few more questions. Grace has given me a few more questions to ask, to answer for you. I think I've answered the first one from Sarah. What distinguishes a Master of Nursing from a Bachelor of Nursing? It's a Master of Nursing pre-registration, so I have to be very, very precise with that. It is a Master of Nursing pre-registration. It is not a Master of Nursing because a Master of Nursing is something that is done when you are already a registered nurse. A Master of Nursing pre-registration prepares you to become a registered nurse. The same as a Bachelor of Nursing, we prepare our students to become registered nurses. The difference between a Master of Nursing and a Bachelor of Nursing pre-registration is the level of education that you receive, as in the level that we expect you to write at, the level that we expect you to learn at as well. It is a very intense program. Sabella, what are the international placement mode common? Can you do this in any semester? No. Our international placements are attached to a unit of study, and an international placement will only be available for some students who apply and are successful in their final semester, in their Year 2 final semester. It is a very competitive process for our international placements. Just Grace has given me another question. No, you can take electives, and this is an anonymous question, so if I would have said your name, but I can't. At the last semester, we have not electives as such. We have streams that you can look at: pediatrics, mental health, acute care. We don't do women's health as such, but in some of the placements you will be able to, and in particular in the community setting, you'll be able to we'll be able to work more in women's health. Just going to have a look at another question for you. It's from and I apologise if I say your name incorrectly, Guida. Is the literacy and numeracy testing in this application competitive or meant to ensure that you meet the standards in order to successfully complete the study? It is not competitive. We do it as so that we can make sure that you are able to meet the requirements for the program. We don't want students to set students up to fail. And as it is a very intensive program, we need to make sure that you're able to meet the requirements to study at the master's level. Just going to have a look at the next question that is being asked. Another anonymous attendee, can you please talk more about the placements and whether students get to pick where they go and in what specialty? The clinical placements are attached to the unit of study. So if it's a paediatric placement that you're after, it will probably won't be able to be available until the last semester when you apply for one of the streams. We spend a lot of time looking at the unit of study that the clinical placement is attached to and finding the most appropriate clinical placement to meet the learning outcomes for that unit of study. I'm just going to answer one, and if I've said your name incorrectly, I apologise. I talked to a couple of nursing graduates and they have difficulty finding jobs in hospitals since they don't have any paid experience. One of the things here in New South Wales is that we have something called a transition to professional practice, which they've now changed the name just for this year. But what we do as part of the preparation in your program, the subject that was called leadership, which is in second year, first semester, and what we teach you is how to prepare to become a registered nurse, how to apply for transition to professional practice positions within the Department of New South Wales. If our students aren't successful in gaining a place, because everybody goes into competition for those placements, the private health sector employ lots of newly graduated registered nurses. So there are many, many placements or many positions that our graduates actually apply for and are successful in. And as I mentioned at the beginning, we have an extremely high employment rate, and this time last year 98% of our graduates from our Master of Nursing pre-registration program were employed. A question from Mons. What does the interview questions consist of? We put you, it depends on if you're coming to a face-to-face interview or if you're having a one-on-one interview with colleagues if you're out of the Sydney area or an international applicant. If you're coming in to have a group interview, we get you to work in a team. We want to see the way that you communicate, the way that you work in a team, because this is what we do when we're in clinical practice. We communicate with our patients, we communicate with our interdisciplinary colleagues and with our patients, families, friends. We communicate a lot. So this is one of the things that we want to see, that you have the ability to communicate, especially with new people that you aren't familiar with or know. We get you to work through a case study when you're in your group for a group interview. For those students that are international applicants or outside of the Sydney area, just ask you some questions about you. We want to see, again, how you communicate with us, how you deal with meeting new people. Hopefully that's answered your question. Nothing to be concerned about. It's very, one of the things with nursing is that we We're very open. We like to talk to people. Another anonymous post or question, you mentioned placements during semester break. Does that mean students don't get a break in between semesters? That may happen. One of the things that you're doing is you're doing 860 clinical hours in 2 years. So it may be that during some of the semester breaks you are required to do clinical placement so that you get all the clinical hours that you need to apply to the registration board to become a registered nurse. Are there any more questions that anybody would like to ask? We're just having a look at the computer screen to see if there's any other questions. Another question. I'm currently completing a science degree. Congratulations. Wondering about career opportunities. Are there any pathways for research in nursing? Definitely, Sarah. One of the things that we are very proud of is our research abilities as registered nurses. You will get to do quite a bit of research during your master's degree here with us. And there are options when you finish your degree and become a registered nurse for you to become a researcher. These are options that you can think about later on. A question, is it okay to apply before meeting English requirements? It hasn't been answered before and it's a great question. You can apply, but you will need to meet the English requirements before you actually commence your degree. And Sydney University, and in fact, Australia as a whole now, universities will be required to, our students will have to have an IELTS score of 7 in each band. So you will need to meet that requirement before you commence your degree here. And this is regardless of Masters of Pre-Registration or our Bachelor's program. A question from Eliza. Can you talk about some of the highlight placements? Like, are there cool opportunities in regional Australia overseas? And if you go to regional Australia, are you able to get universities financial support? I'm going to chop it up into little bits so that I try to answer all your questions, Eliza. There are some amazing opportunities for clinical placements in regional and rural placements. The placements that you get or that you can apply for with the air ambulance in some of our country hospitals, with Justice Health. The opportunities are enormous. I'm trying to think of all these great opportunities for you, but it's not only rural and remotely, but even within the Sydney metropolitan area, that the experience and the opportunities you get will be enormous. In regards to financial support, it will depend on the placement that you're going on. There are lots of funding opportunities. It will just depend. So I can't actually give you very much more information apart from that. This wonderful question. Since I have no background knowledge in nursing or health, I'm thinking to study a diploma of nursing for half a year before becoming a master, before the Master of Nursing. Is it a wise decision? One of the beauties of the Master of Nursing pre-registration program is that we have our students come from such diverse backgrounds. At the moment, we have somebody that was a journalist, somebody that was an optometrist. Think of all the amazing people, an actor. Trying to think of other amazing people that we have, which everybody is amazing. But you don't have to have a health background. This is what we teach you in the Master of Nursing pre-registration. We teach you about health. We teach you how to become a registered nurse. And that's one of the great things. We have such a wealth of knowledge and experience from our student cohort, which actually makes it very rich and a great learning environment. So if you meet the requirements to come and do the Master of Nursing pre-registration, come in and do it with us. Don't do a 6-month program anywhere else. Come and do the Master of Nursing pre-registration program, and we'll teach you how to be a great registered nurse. Another question from Elisa. In the application process, do you look at what the person has previously studied and what work experience they have? We look at your result from the numeracy and literacy test and how you go in the interview. Your previous experience and your previous degree is of interest to us, but it's not what we look at very closely. We look at your ability to pass the numeracy and literacy test and how you go in the interview so that we can make sure that you're going to do well in the program. I think we've answered everybody's question. If you have any other questions, please get in contact with us. There's our website details there. If you come to the website, you'll find me as the Director of Pre-Registration Program. Please feel free to email me with your questions, and I'd be really happy to help you. We're going to wrap up this afternoon and hope that you've enjoyed what we've offered you, and hope we look forward to receiving your application, to assessing your applications, and to meeting you during the interview, and hopefully to meet you in our program next year. Thank you very much.